Chandur Wadhwani, prosthodontist from Bellevue, Washington. My tip today is how to protect the sulcus of an implant when you restore. So many of us still use cements when we restore dental implants. What we have to notice about the sulcus around a dental implant, it's very different to the sulcus around a tooth. For example, it's usually non-keratinized, which means it's highly permeable. In fact, the sulcus around an implant is about 15 times more permeable than the skin on the back of your hand or the front of your hand, the palm. You also have to understand that it has a very low blood supply or very poor blood supply, so its repair capabilities are very poor, and that makes it more vulnerable than a natural tooth when you damage it. And the other thing that you have to know about it is that the permeability will allow materials to go through. So it's non-keratinized, highly permeable, has a low blood supply, the complete opposite to a natural tooth. So when you do things like place retraction cord around a natural tooth, it really causes only minimal damage. You place retraction cord around a sulcus of an implant, you cause huge amounts of damage that may not repair, and you might start the cycle of the soft tissue starting to want to move away from the implant and cause an irritation. So one of the things that I do is when I cement an implant restoration, I use a small amount of polyteflon tape, PTFE. I'll cut about 1/4 inch off and use a rubber dam and punch a very small hole in the center. I'll then pull that up over the connection of my abutment and leaving my cement margin free, so that when I place it in, I have like a mini bib exactly around the implant itself. That, as long as I keep it free of the junctions, both the cement margin junction and the junction between the implant, I can then cement my crown and I can make sure that I'm not getting any adverse material that can cause damage to the sulcus into the sulcus. So after the cement has set, I simply pull it away and it's completely protected and produced like a dam or a bib effect. So that's my practice tip for you today. So thank you very much.